if you recall, there's some time back, the availability of effective vaccines is a turning point of the pandemic. And our high vaccination coverage is one of the key reasons why we could progressively restore normal lives while maintaining one of the lowest mortality rates due to COVID in the world, and arriving at today's DORSCON Green endemic new norm. So in Singapore, we have a very strong, what we call hybrid immunity, a combination of protection arising from both vaccination as well as safe recovery from COVID. We estimated probably close to 90% of residents here have already gotten COVID. Over the past months, our data also showed that this hybrid immunity stayed very strong. EC19V has updated its recommendations on vaccination requirement for COVID for the year 2023, while monitoring further developments. And MOH agree with these recommendations, and they are as follows. Let me start with the general population. For everyone 5 years and older, they are recommended to attain minimum protection. That means 3 doses of mRNA or 4 doses of Sinovac. No change from previous recommendation. That's why they are called minimum protection. It's still relevant. And having minimum protection is part and parcel of the endemic new norm. And individuals should proceed to get them if you have not done so. Second, the most vulnerable groups, and these are individuals aged 60 and above, medically vulnerable persons, or residents of aged care facilities. Many of them are currently protected by boosters or recent recovery from COVID-19, but this will likely wane over time because of their vulnerable status. Hence, they are recommended to take a booster dose of COVID-19 vaccine at an interval of around 1 year after their last booster dose, essentially annual booster, very much like influenza. And the difference is, currently the recommendation is 5 to 12 months interval. Yeah, take your booster 5 to 12 months after the last dose. Now we move to annual vaccination for this group. Third, younger, healthier, less vulnerable persons. They are much less affected by COVID-19 infections, especially if they have already attained minimum protection. Hence, individuals aged 12 to 59 will be offered an additional booster around 12 months after their last dose, if they choose to take it. This is a notch down from the current guidelines, which is that they are recommended to take it. Now they are offered instead. Fourth, young people aged 5 to 11, or rather children aged 5 to 11, they should attain minimum protection. They are not eligible for boosters, no change from now. Fifth, children aged 6 months to 4 years, they are recommended to complete their primary vaccinations. That means 2 doses mRNA. They are also not eligible for further boosters, no change from now. We will continue to monitor the situation and track the data. The recommendations will be constantly reviewed. You will notice what I said was EC19 recommended. This is the guidelines for 2023. So they will continue to update that periodically based on pandemic situation and the strength of our population hybrid immunity.